We have given junior doctors between 8 and 10% this year. And if you look at the deal they settled with in Scotland, which was 17% over 2 years, that's not too dissimilar a deal. And yet they're not settling with us in England.
What even is this bollocks? The government has not offered junior doctors in England a 2-year deal. So there's no guarantee of another 8% next year. In fact, they could just impose 1% on them. Suggesting the government's offer of 8% this year is in any way comparable to a 2-year deal done in Scotland at 17.5% is simply ridiculous.
And yet they're not settling with us in England.
What this government has offered junior doctors is little more than a crappy real terms pay cut, and the health minister knows it. And that's on top of the massive 26% real terms pay cut junior doctors have suffered since 2008.
On the issue of junior doctors and the consultants, they're asking for a 35% pay increase. And that would do what we're seeing is stoke inflation based on pay rather than costs. And then that makes inflation much harder to tackle.
It's not the first time the health minister has used this completely debunked argument.
So, one of the factors that we have to consider, particularly at a time of high inflation, is if we do inflation matching pay rises, that can actually drive inflation further.
It was complete bollocks then, and it's complete bollocks now. This argument, constantly used by the government to justify inflicting crappy real terms pay cuts on NHS staff, has been rubbished over and over again by expert economists. It's not rocket science. If a private sector company increases its wages, yes, that goes directly into the cost of making that product or service, and that might end up increasing the price. But that's not the case with public sector workers such as healthcare, which are free at the point of use. That means consumers don't pay for them directly, so they don't affect the inflation statistics.
And 6% to consultants. And we think that's fair and reasonable, given that's what was recommended by the independent pay review bodies.
Well, imagine the health minister's shock when she finds out 6% is a crappy real terms pay cut. And she'll fall off her chair when someone tells her that since 2008, the real terms take-home pay of consultants in England has been cut by a staggering 35%. And that's before the impact of this year's soaring inflation. So on what planet is the government's offer of another crappy real terms pay cut?
Fair and reasonable.
And it gets worse.
So, today's offer is final. There will be no more talks on pay. We will not negotiate again on this year's settlements, and no amount of strikes will change our decision.
Well, let's be clear on this. What the Prime Minister is saying is that if they won't accept crappy real terms pay cuts, he's just going to impose them on them anyway. Well, absolute bollocks to that. Imposition is not a negotiation, it's bullying and it's intimidation, and that's just not how we do things in this country. And if that's not appalling enough, if they won't roll over and accept Sunak's demands, he actually plans to strip them of their democratic right to strike, force them to work against their will, and allow them to be sacked if they refuse. And if you think that's bad, just watch this.
What we've seen actually is that our plans were beginning to work. Ambulance and waiting times down from an hour and a half over Christmas to around half an hour. Virtually eliminating the number of people waiting 1.5 years for treatment. Making huge progress on GP access. Now all those things, all those plans we put in place, all the funding, all the extra ambulances, the extra discharge, all starting to make a difference. All held up by one very simple fact. Industrial action in the NHS.
Imagine working in our NHS and having to listen to that bollocks. Does the Prime Minister really think the country has suddenly suffered mass amnesia and forgotten that before these strikes began there were millions of people on hospital waiting lists as record numbers of patients waited for routine hospital care? By now even Larry the Cat knows hospital waiting lists are the result of a decade of underinvestment by this government, which has left the NHS with too few beds and too few staff. That's part of the reason our doctors are taking action. Who are we going to believe in this dispute? The doctors who sacrificed so much to keep us safe during the pandemic, or a government that lies about practically everything?